Welcome back to Tort Talk. I'm John Robinson, one half of John and Mark. Mark is out this week, but we still have Joe. Thanks for joining us. We are here to talk about the latest and greatest in mass torts. And this week, we saw some news break outside of the legal space, some really big news, the administration making some announcements about the link or potential link between Tylenol and autism. Definitely the biggest story dominating the news cycle this week, and obviously dominating mass torts. The administration just announced that the FDA is putting new guidelines for pregnant women taking Tylenol. We talked about this litigation in a prior episode, but how do you think this announcement is going to impact this appeal, if at all?
Yeah, like you said, John, this is the biggest news item dominating everything. So what happened was the administration came out and said that there's an association between pregnant women who are taking Tylenol and then also autism and ADHD. As a result of that, the FDA is putting out the new guidelines, and basically they're suggesting that women who are pregnant only use for a short amount of time and the lowest dosage possible. So what they're saying is that there's this association, which us on the plaintiff side have believed for years, but there hasn't been a causal connection affirmatively determined yet. It seems like that's still up in the air, and this is something what we've been arguing about in these cases that you remember that got kicked out back in December of 23. So in those cases, we made the same exact argument that the acetaminophen was causing autism and ADHD. The court ultimately rejected our expert opinions and excluded them. We appealed that up to the Second Circuit. In about 2 weeks from now, in the first full week of October, we have oral arguments on that. So in the Second Circuit, we usually see about 4,000 to 4,500 appeals each year. And what we should expect is a decision in about 4 to 6 months. So in early 26, we're going to see if the court allows our experts to now come in. One important piece of information that I thought was really important to share is originally when we got our experts excluded, the defendants relied upon the opinions of the FDA that said it was safe for use in pregnant women. So now that FDA's on the plaintiff side here, it'll be really interesting to see how the Second Circuit comes down, but this could totally change the litigation overall. And even if we lose in the Second Circuit, I expect there to be a lot of litigation in state court for acetaminophen, going to be the biggest mass tort of 2026. Mark that down.
Yeah, a lot of information coming out. The public has a lot of questions. We've definitely seen an uptick in search volume around Tylenol and autism for people just trying to understand what's real, what's not. So it'll be interesting to see how this plays out over the next, call it 6 to 12 months, and whether or not this litigation winds up firing back up again. In other news, Depo-Provera, we have the preemption argument next week. We're up to about 800 cases pending in the MDL. What should we expect to see at that Depo hearing next week?
Yeah, this whole litigation pretty much depends on the outcome of this hearing. So basically what we have is the defendants arguing that plaintiff's state failure to warn claims, they're all preempted. And basically what they're saying is they even went to the FDA in 24 and suggested a warning related to Depo-Provera and these brain tumors, and the FDA said none was needed. That really isn't the full story from our perspective. What information did they have? When did they have it? What exactly was it in this suggested warning? And they could have even, in our opinion, made some changes without the FDA approval. So if we're able to beat back this motion, the litigation is going to take off in the MDL. Expect to see huge filings there. If not, if we're unsuccessful, expect to see the litigation to pivot and go to state court. So this is a crucial hearing. Usually in mass torts, we're successful at this preemption argument. It's made in pretty much every case, but the defendants do think they have a stronger argument here because of what they presented in 24. Fortunately, we're expecting a ruling before the end of the year, probably 30 to 60 days. We'll know what's going to happen in this Depo-Provera MDL.
Do you have any idea about the scope of the number of cases that may have not been filed yet for Depo and brain tumors?
As we talked about before, there was a previous order from the MDL judge instructing leadership to file all of their cases. So in the last month, we saw an increase about 300 or 400 cases. I know there's a lot of firms that are still investigating cases. I would imagine that if we're successful here on this preemption argument, I think that this litigation will end up seeing somewhere between 25 to maybe 35,000 cases. The proof's a little bit harder in these cases because the records are going back 20, 30, 40 years. So getting evidence to prove usage of the Depo-Provera is a little bit harder than we typically see, but this will definitely be a huge mass tort. It won't be quite as big as Roundup or Johnson & Johnson, but it would definitely rise to the top 3 if it was an active mass tort with all of the cases filed right now.
Next, we've got social media addiction. This one's been going on for about half a decade now, and we finally have a case management conference being held last week where both sides presented competing proposals for that initial Bellwether trial. What can you tell us about the status of the social media addiction litigation?
So in the social media addiction, we have, again, an MDL going on and then a parallel state court proceeding. The state court proceedings in the JCCP out in California, that's where this first initial Bellwether trial is going to be conducted. It's scheduled to kick off in the beginning of November. It's going to be an individual plaintiff case. There's some cases that are individual plaintiffs, and then there's also some school district cases as well. There's about 2,000 or so cases filed in the MDL, and so we'll expect a ruling hopefully before the end of Thanksgiving. We've gotten some positive rulings on some motions to dismiss recently, but this is one to definitely keep an eye on, and it might even give us a blueprint for the video game addiction, which is another litigation that looks like it's about to explode.
Yeah, a lot going on over the past few months across all these litigations. It's good to see some movement happening. That initial Bellwether trial coming up just about a little over a month. On Suboxone, that's a case where there are potentially many plaintiffs who may have been affected here. We've got about 20,000 already filed in the MDL. We've got about 500 cases that are in the process of being worked up. What's the status of moving these cases towards trial?
Right. Like you mentioned there, John, the initial group of 500 cases were the cases where the plaintiffs had to submit the fact sheets, submit record proof of usage and diagnosis of an injury. The idea was to pare down that initial 500 down to about 50 cases. And then from there, we were going to get down to about 15 to 20 cases that were going to get further worked up through the Bellwether process. So we're still working through that initial batch of 500. It's taken a little bit longer than the court and parties expected, but we should have that number finalized here and be able to get towards the Bellwether process sometime next year. It might even be more than a year until we get a resolution in that case, but getting records, getting all the providers to comply, it's been a little bit burdensome. Keep an eye out in that litigation for an updated case management court order coming out probably in October of November related to the more recently filed cases in the summer of 25. That will set the deadlines for the fact sheet and everything you need to know.
Great, thank you. Another higher volume case, hair relaxer, had a lot of attention last year. You see firms starting to pay more attention to hair relaxer recently. It's a large MDL docket. We've got about 11,000 cases pending. We've really seen a flurry of activity with expert discovery deadlines, but keeping science day for early January 2026 and setting deadline of April 26 for expert discovery. What do these rulings mean for the litigation?
Yeah, it's just really keeping everybody on track here. So like you mentioned, this litigation, we have about 1,000 filed cases in the MDL. We have a couple state court proceedings going on, but we're really focusing on the cancer cases in the MDL. And like you said, we have that all-important science day scheduled in the beginning of January of 26. That's basically an opportunity for the parties to come in, bring some of their experts, explain the science, explain the background, explain the evidence to the court to get them really educated. So then when we present those expert opinions and then we have the hearing, the all-important Daubert hearing, the court has that background and familiarity with the issues and the science so they can better understand it. But basically, it's looking like right now, sometime in the summer of 26 is when we'll have that initial Bellwether trial. We've seen it in other litigations, such as CPAP, more recently here in the AFFF. Right before the Daubert hearings is when there's that huge uptick in activity and the settlement discussions really get intense. So I anticipate we're going to see a number of cases filed through the rest of the year, probably 1,500 to 2,500 more cases. And then in 26, a mad dash, hopefully before a settlement in the second quarter of 26.
Really great to see that progress. Today we've covered hair relaxer, Suboxone, Tylenol, social media addiction, Depo-Provera. If there are cases that you are interested, those of you watching, in getting more information about, please leave a note in the comments, send Joe or us an email, and we'll be sure to get you updates on those case types. We also look forward to seeing everybody at MTMP. We're about a month away from the biggest mass tort conference of the year at the Bellagio. Joe, Mark, and myself will be there. We'll be planning some special interviews that we'll be doing while we're on site. We'll do an episode of Tort Talk while we're on site, and we're really looking forward to that event and meeting everybody who has been a part of watching these episodes over the past few months.
Yeah, thanks for having me, John. Look forward to seeing you out in Vegas in a couple weeks.
Yep, those of you watching, we'll see you next week for Tort Talks.